Hey, welcome to Talking Insurance Hacks with Nkeng Forka, a podcast that breaks down insurance jargon to help you and your family make smart insurance decisions. Great to have you here. I'm your host, Nkeng Forka. I'm a licensed health insurance professional, and it's a very exciting time of the year. So today I would like to dedicate this very groundbreaking episode to this very crucial decision for seniors. If you are over 65 or you are turning 65, this must be a very exciting time for you in the year. And that is really what this is all going to be about. So please stick around. We are going to be reviewing the Medicare and You 2025. That's really all what this conversation will be about today. So most of you must have gotten that in the post or in the mail. I'm going to go ahead and try to break it down so you can get all that you need to know going into 2025 ahead of our open enrollment window that starts on the 15th of October and it runs through December 7th for you to make your decisions and choice for what your coverage for 2025 would look like. So again, that deadline runs from October 15th through December 7th, 2024 for you to make that decision. Here's what we're going to do in this podcast today. On the very first aspect of it, I'm going to try to define what Medicare is. For those who are new to Medicare, I would try to break it down as simple as it can be. And then we'll go ahead and look at the different parts of Medicare. So the Part A, the B, the C, and the D. And then I will go ahead and try to explore what your options are in terms of what you can get in Medicare once you are eligible. We will look into the things that you need to avoid. I would like to advise you to stick around. I'm going to break those things down at the very end of this conversation. I think it's probably the most crucial point that if you would stick to the end, you might take out of this whole conversation today. How to save you money from really simple mistakes that I've seen so many seniors make into their take into their graves, right? Those late enrollment penalties. That's money you should never be giving to the government. You should never. It's really simple. Just make sure you do it on time. And I'm going to really help you break it down and see how you can avoid really putting money that you should be needing so desperately in your retirement age than to have it sent to the government in terms of late enrollment penalties. So let's dive in. I'm just going to start off here by describing or explaining to the layman's understanding what Medicare is, because I think that's a topic for those who are already on Medicare might not be too important, but I think it's worth describing or defining what Medicare is, so we can go into this conversation with a very clear understanding of what Medicare is. So I'm just really gonna keep it simple to the description as per the Medicare and You 2025 review booklet that you must have received. If not, you might actually request a copy, or you can go online and download a copy for yourself on CMS's website. So let's start with that basic. So Medicare is a federal health insurance program that primarily covers people of age 65 and older. Now, though some young people or folks can actually qualify for them, that will be people who have disabilities or certain health conditions that would deem them eligible for Medicare. I'm talking of those who have, I think, renal disease and some of the other health conditions that will be defined as per the CMS standards. CMS I'm referring to here is the Center for Medicare and Medicaid Services. They describe and define who qualifies for Medicare. So that's the definition of Medicare. So if we can break it down here, it's simply saying that while you live your life throughout the time in the United States, before 65, you would typically buy insurance for yourself and your family in the marketplace. However, or through your employer, right? So that either way. When you age up to 65, you would now qualify for Medicare, which is basically saying that all the money that they've been putting aside for you throughout your working life, and if you take a look at your paycheck, I mean, for those who actually have an employment that has a Medicare, as a matter of fact, if you do have a job, much of that paycheck you receive, you would notice in there that there is a deduction for Medicare. So once you turn 65, all that payments you've been making, right, kicks in, and then you start receiving the benefits of which you have been putting aside through the paycheck deductions. So that kicks in on the first of the month that you turn 65. So if you were turning 65, say in October, your Medicare eligibility will begin on the 1st of October of 2024, sorry, and so on and so forth. Well, bottom line here is you become eligible for Medicare once you turn 65, at which point you will now start using or enjoying those benefits that you've been saving up for. So it's really just using that money. Just a caveat here, I want to also indicate that a lot of people typically don't take their Medicare once they turn 65. So it's something worth mentioning here just because it can get very confusing. Or out of ignorance, some people just don't know and continue to pay higher insurance costs by sticking with their employer coverage. So I would like to just talk on this really briefly, but also bring a very important point out of this. So typically the rule says if you turn 65, you're eligible to start enrolling into the Medicare and enjoying the benefits of Medicare, right? However, it doesn't require you to if your employer still offers you coverage, right? So to say, if you are on an employer coverage and you turn 65, you could still say, okay, wait, I really don't want to start using my Medicare right now. I will stick with my employer coverage until I can no longer work. And I would then become, or would then pick up my Medicare and start using my Medicare coverage. That is an option. It might work for you. I'll give you a classic example of how that matters or why that matters at all. Why I think anyone should do it that way anyway. Let's say you are providing insurance coverage for your family, your spouse, maybe some disabled children, because people mostly in that age group would have already gotten to a certain age that they might not even need to cover their kids anymore. But the typical classic examples would be people who cover their spouses and any disabled family members, for that matter, under their coverage. So it would make great sense for you to stick around with your employer coverage so you can cover your spouse and all other dependents, as the case might be. So that gives you room to keep them under the coverage, right? Because if you drop out of your employer coverage, Medicare is just for you, right? It's only an individual coverage. It doesn't cover you and anybody else. It covers just yourself. But if you stay with the employer coverage, Medicare, the employer coverage, of course, would then keep them under the coverage which you have through your employer. So that makes sense, right? On the other hand, I also want to just warn that if you make that comparison, right, and see that the cost of employer coverage, just because it's provided through your employer, doesn't make it any cheaper or make it any better. What people tend to fail to understand, because they think, okay, well, I got coverage from my employer, I don't need to bother about it, I might just stick with it until I can no longer work. Well, think of it this way. The employer certainly charges you for that coverage. So look into your paycheck, see how much they're taking out of that paycheck for the coverage that they provide. and compare what your Medicare costs would look like. So you would be able to see, oh, if I decide to go this route with Medicare, how much am I going to spend in a year towards my coverage, right? That should be a very simple decision to make. If you find out this one is going to cost you more versus the other option, whichever option works best for you in your circumstance, I would say that's what you want to, go ahead and save that money that you so desperately need at that stage in life. I mean, retiring is never financially an easy thing to transition into. So anything that you can do to save money towards that retirement life is a big win. So please take that into consideration. Great. I hope that makes sense. And if it doesn't make sense to you, please do not hesitate to reach out. I'll be more than happy to break it down for you and explain every single thing you need to know about your options of either sticking with Medicare or continue with employer coverage. But the key takeaway here is if you need coverage for dependents, your spouse and any other dependents as the case might be, it's worth keeping an employer coverage even after you have been eligible or become eligible for Medicare, which is the age 65. And for those who obviously get it through disability conditions under the age 65. Now, let's look at it from the different parts of Medicare. This is the most confusing part of it, but actually the simplest part, which I like to break it down. And I'm going to use what I usually, term as a formula for Medicare, which is very simple, right? So A plus B plus D equals to C. So those are really the four parts of Medicare that I've kind of put in a formula. So if you say part A plus part B plus part D equals to part C. That's really what that is, Medicare. And I'm going to break it down and then tell you what other option there is. So your part A here being hospital insurance. And I'm going to kind of really stick with the book, okay? I don't want to do any out of the cuff's explanation of what that is. So I'm going to read right off the cuff the book, what it says. So part A covers in inpatient hospital care, skilled nursing facility care, and hospice care. Most people would get this without paying a premium, and if they paid any Medicare taxes while working. So typically, you've actually covered that cost throughout your working life. It says if you work, I think, 10 quarter hours in your lifetime, you would qualify for a Part A Medicare without premiums, right? Which goes to say, if you did not work that much time during your lifetime, you might have to pay a premium for the Part A. So it's not a given, right? If you did not work that time required to qualify for the Part A, you would not get a Part A for a free premium. You might have to pay a premium. So keep that in mind. It might happen to people, especially for migrants. I would usually see this with migrants, people who came into the United States at some point in their late ages and then became eligible for Medicare. Obviously, you will not have worked that much time, and then that would put you in a situation where they might have you pay a premium to cover your Part A. So once again, the Part A really just takes care of when you get to the hospital, or if you have any in hospital-related skilled nursing facility services, hospice care, obviously, or in-home support, all of that kind of stuff is what you would see covered under your Medicare Part A. The Medicare Part B, as in boy, will be what they would describe here as outpatient care. So outpatient care here means, think of like your doctor visits, preventive services. Preventive services here meaning your annual checks, typical annual checks, blood work, all of that good stuff. That's what they're referring to as preventive services. That would also include medical equipment like wheelchairs, mental health services. There is a monthly premium for the Part B. And this for 2024 is set at $174.70 a month. Now, keep in mind that might be different based on your income, right? It says if you have an income over $103,000, that premium of $174.70 might be different. So it's going to be adjusted based on your income. That's something to keep in mind as well for a single person. And for a couple, I think it's over 206,000. So you kind of double that up and see for yourself. So if you're making that much money at that point in time, your costs for the Part B premiums might be different, might be a little higher, just because they're adjusting that premium based on the income if you have an income over 102,000. So that is something worth keeping in mind here. And as I also mentioned, there is also the Part D. So you realize that I've skipped the C just because it's not really relevant to talk about it. It will make much more sense later on. So the Part D, as in David, is what you would call the prescription drug coverage, right? This helps to cover the cost of your medications that you would need throughout the year. And thanks to the new law, you must have already been heard about it. There's a lot of noise about it lately, which of course is for good reason too, right? This used to be probably one of the most challenging aspects in my experience with Medicare beneficiaries, what they're really challenged with. This new law would say is that your out-of-pocket costs for prescription drugs is capped for the year 2025 to $2,000 per year. All right, let's break that down. It might not make a lot of sense, but think of it this way. It says no matter what, right, no matter what kind of medications you're on, you cannot spend more than $2,000 in a year to cover for prescription drugs, which I think is groundbreaking, because usually that cost could go from anything to $6,000 and above, which is usually the max out-of-pocket that you would have from a prescription drug plan. What the law simply says is the Affordable Care Act, which I think probably one of the best things that the government did was to cap that into $2,000. So you will never pay more than $2,000 in a year. So what that means is simply the insurance company is going to pick up the slack for whatever that your cost for your medications would be, and you would definitely only have that share of $2,000 to worry about. Once you've made your contribution towards the $2,000 maximum out-of-pocket cost, the rest is up to your insurance coverage provider. Here are some of those benefits for those who are still on the fence on whether to join or use their Medicare. Well, if you don't use Medicare, I don't see you qualifying or using those benefits, right? So this is really a big plus. Why you should use your Medicare once you're eligible. Because if you stay on a regular health insurance plan for families and individuals or employer coverage, probably this will not apply to you in that circumstance, even though you might qualify for it. You are not under a Medicare plan, so that typically would not be to your advantage. So again, very important point to take away from here. That the cap for your prescription drug coverage for 2025 will be $2,000. I think that would make a huge difference for the seniors, knowing how expensive that used to be. The other part which I would like us to go into here before we wrap it up is I will talk about the Medicare options, right? Which brings me to the Part C, as in Charlie. C simply means that when you combine the Medicare Part A, which is the hospital insurance, the Medicare Part B, which is your outpatient services like doctor visits, and then the Part D, which is the prescription coverage, into one plan, it's also equally called a Part C or Medicare Advantage. Those are the interchangeable words that you would hear out there. They're being referred to as a Part C plan or a Medicare Advantage plan. They mean the same thing. Just don't get confused when you hear a Medicare Advantage or Part C. It's the same thing, actually. So that's why I said if you do the formula like I mentioned earlier, the A plus the B plus the D equals to C, right? Breaks it down really simple. So that's really what Part C is, right? And again, just a caveat here, what a Part C is, just to put it together in a very simple word, it's a bundle of your Part A, B, and D into one plan run by private companies, right? Again, these are insurance companies mostly. They would have been approved by Center for Medicare and Medicaid Services, CMS, as they're best known, which would have approved these insurance providers to provide you coverage. They offer, usually most of them would offer some extra benefits like vision, dental, or even fitness programs that you need to stick into a doctor's network to take the full advantage of. There's a little more complexity to the Part C or Advantage plans that I would do a separate video for, or podcast for, so we can break that down. I would rather make it especially for Part C plan and the other option, which I would also discuss here briefly. But not today, because that is a whole section on its own. But the takeaway here is the Part C basically have A, B, and D, plus other benefits that Medicare would typically not cover, like vision, hearing, and dental. It will include some of those benefits, or fitness programs, or health food programs, most of those things that would all come, transportation services, things like that. You can find them in many Advantage plans. So that's really why it's called an Advantage plan, right? Because it gives you some things that Medicare typically wouldn't cover, but they would provide it for you based on the plan that you would choose. So I'm not speaking here for any particular insurance company, so I will not go into any of the details here or specifics as to what any program or plan offers. But again, this is offered through private insurance companies. So we will look into that in another special edition where we will cover all of that. The takeaway here is you want to make sure, right, you find the right plan that fits your circumstance and your needs. Really, that's all what that comes down to. Make sure that the plan that you go with meets your specific circumstance needs, right? That's really what that will come down to. And you can find plans from as low as $0 per month to as high as it could be, right? So there are premiums on certain plans. So typically the lower premium plans would get you to some level of responsibility. Keep that in mind in any insurance contract, right? The lower your premium, the higher your share of costs. The higher your premium, the lower your share of costs. There's always that trade-off. I would like you to think of it that way. It's always going to be a trade-off between your premium versus your share of cost. Share of cost here meaning what you would also contribute towards services that you're provided. That could come in deductibles or co-insurance or basic, whatever the insurance company would share with you, right? That's what I'm referring to here as in share of costs. So if you have a $0 premium plan, chances are you might have co-insurance. Co-insurance here meaning when you go to the doctor, instead of having to pay nothing, you might have to share the cost. The doctor's office might charge you some level of monthly payment to make for that visit. And then deductibles obviously would be the amount that you would have to pay for the insurance to complete the remaining balance on whatever services you would get. So that's really that trade-off that I just wanted to highlight here. The main thing here is if you like flexibility, there is the other option, which I also would like to highlight. It's called Original Medicare. What that means basically is that you decide, okay, I don't want any of this Medicare Advantage C plans, right? I just want to stay with my Medicare, which means you have your Part A, your Part B, right? That's what your Original Medicare includes. Hospital insurance, A, medical insurance, B, doctor office visits and stuff like that, or outpatient stuff. Now, the tricky part here, just to get into this whole Original Medicare thing, is it does not include a prescription plan D by default. But when you're eligible for Medicare, Medicare typically go ahead and enroll you into a plan for the prescription drug coverage, which they would typically send that along with your enrollment decision or your eligibility decision. The reason being, they just don't want you to go into any penalty, right? Or default into penalty when you get into Medicare, because a lot of people probably don't even know that they need a prescription drug coverage, so they might not buy one. And the problem with that is if you do not have prescription drug coverage and you go beyond 63 days, you will be eligible for, or you would have been violating a rule for Medicare prescription drug coverage, the requirement, which will get you to pay a penalty. Again, those are the things I was talking about to stick in the end. If you want to avoid that penalty, please make sure you maintain the prescription drug coverage. If you do not like the prescription drug coverage that the Medicare or default enrollment option included in your coverage, you can go ahead and opt out of it and buy the one that you would think would work best for you in your area and get you the most out for your prescriptions. So please don't forget about that. That's a very important one. Don't forget it. I've seen so many seniors being paying penalty for not having prescription coverage. Really not necessary. It's something you just have to pick one plan and roll with it and avoid that penalty. So that's something worth mentioning. If you decide to go with original Medicare, I'm going to talk a little bit about that also in a separate video, just because I don't want to get all that congested information. It's way too much information to digest at once. So we will stick with really keeping it basic here. With the original Medicare, again, as I said, you would have your Medicare hospital insurance A, if you qualify for that, of course, without a premium. If you do not, you would have a premium. And the Medicare insurance B, which has a monthly premium of $174.70 for 2024. If you are earning an income over $103,000 for single or $206,000 for couple, you might have a different premium cost for the Part B. So that's really all what you're going to worry about if you decide not to take the Advantage plan or the C plan. You would then be under original Medicare. And what's good about it is just a matter of flexibility, right? So the flexibility here means you can see doctors no matter where you want to go. All the doctors that accept Medicare, you can go and see them, which in most cases under an Advantage plan, those options are not there for you, or that flexibility option is not there for you, right? Because most of those Advantage plans will be offered through a network provider coverage, and they will require you to see providers within their network. So you don't have that flexibility as per your original Medicare. So that's really the main difference here. If you decide to stick with original Medicare, then you would have had your work cut out for you, that you don't stick with any particular insurance provider. You can go to whoever would accept Medicare, and then they would bill it to Medicare, and you would have to pay obviously your 20% of the difference, because that's a very important point to also make. Like if you are Medicare only covers about 80%, right, of your costs for care, which you would now be saying, if I don't want to take an Advantage or C plan coverage, I'm taking that responsibility to share that 20% difference in costs. Say, for example, you went to the doctor and the bill came down to $100. Medicare would typically pay about $80, and you will be left with a $20 difference. That's a very simple breakdown of how that would work if you're under original Medicare. Now, keep in mind, there's also what they call the Medigap or Medicare supplement plans that also come in there to help you to take care of that 20%. They have Plan A to Plan G, so there's a wide choice as well as an option there, which again I would explore in another podcast session. So our seniors who might be interested in that will be able to see what the advantages are. So I'm going to do like a comparison, right, for Medicare Advantage versus the Medicare Gap or Medicare Supplement plans. So whatever Medicare does not cover, those plans will typically pick them up and cover it for you. Now, the main difference there is they also have a premium for those plans, usually a little much more higher than your Advantage plans would cost, simply because they're basically saying, we are going to take care of you, right? So you pay the premiums and they take care of you. Even if you don't have any health conditions, you would have paid that premium for the supplement or Medigap plan. That's really the bottom line. With the Advantage plan, you're saying, well, I will share the costs if I do get to need services, versus I will pay you the money, and if I need services, you would take care of it. So that's really the difference, man. Bottom line. What I would like us to do in the final segment here is to look at things to avoid, and obviously what are the changes in 2025, right? Which I've already pinpointed one of the main difference in the prescription coverage, but I'd like to go ahead and highlight those changes, because I think that's really what this book typically would like to do for you in going into any Medicare period or enrollment period. If you haven't received a copy, please go ahead and request one. You can call CMS or Medicare, 1-800-Medicare. You can request a copy of this. It should be sent out to all seniors. If you're qualified for Medicare or you're becoming eligible for Medicare, you should get one in the mail. Very important document to review, basic stuff, all the options that are available in your area, everything is in here. So what I'm going to do right now is kind of look into the main highlights of what is different for 2025, and we will wrap up in our discussion for today. So the very first thing, which I already mentioned, was the lower prescription drug costs. As I mentioned earlier, your yearly out-of-pocket drug cost will be capped at $2,000. So you can also spread your payments across monthly installments. The great news is for anyone with high medication expenses. I'm talking about those who are on what they call high maintenance medications, from diabetes to any condition that requires you to take constant medication, right? Monthly medications. That, I think, would be a big win for you all, because you would cap your cost at $2,000. So it doesn't mean you would have to pay $2,000 at once. What that simply means is, let's say you were usually getting your insulin at XYZ amount. They've capped that to $25 at most. So you would start to get your insulin supplies and paying your $25 each time you get those supplies. And any other prescriptions, for example, once you must have met that $2,000, once that total amount that you spend for prescriptions hits $2,000, you would go for prescriptions and not have to make any more payments. That's really how that would work, right? So don't expect to go at once and they ask you to pay $2,000. It doesn't happen that way. It's going to accrue over time. So it's adding up each time you make a payment. That adds up towards the $2,000 out of pocket. So that's how that's going to break down. So don't expect to pay $2,000 at once, or that you might not even make up to $2,000 based on what your needs are, right? That's also a possibility. But the good news here, I think, and bottom line is, it's going to cut down the cost significantly for people who are on high maintenance drugs, because those things don't come cheap, right? They're just not cheap. They're expensive. So if you can cap it to $2,000 in a year, you definitely would save a lot of money towards other very important things for seniors on a fixed income, especially with the inflation, no doubt. That certainly would make a big difference. I think another very important aspect here, which tend to be ignored a lot, is the expanded medical health services, medical and mental health services. Like that Medicare is adding more mental health support. So you can now access services from family therapists, mental health counselors, plus intensive outpatient programs in some areas. So of course, this is not across the board. Accessibility to those services is based on what the availability is in your area. So I would not want to umbrella say everybody would get equal service in this level for mental health. But again, I think that support is also have been improved significantly into 2025. So if you're in any way, shape, or form challenged mentally, please don't hesitate to use those benefits. They are now included in your Medicare coverage. You should not be paying much more for it than you would usually have done in the past. So I would say take advantage of that. There is also what they call a caregiver support. I think that's another very great improvement on the Medicare program. So if you're caring for someone on Medicare, the good news is there's more support for caregivers like you, taking care of, whoever you're helping with that Medicare situation. Like training to help you take care of your loved ones. You can, get all of that support that you need. Or if they're in hospice care, there's now more relief for the caregiver. So you kind of get support, right, for doing that very, very important role as well, especially for those who might be challenged towards their final days. So that kind of really comes in to help them a lot. And the number 4 aspect, which I would just want to really talk about it, but I think we already seen it a lot during the lockdown from the pandemic. The telehealth services became really popular. So through the end of 2024, you can now access telehealth services from anywhere, right? So again, another very important service that most people don't seem to take advantage of, but I think is key. If you don't know, you sure do have a lot of telehealth services provided to you by most of the insurance or Medicare coverage. So please use those telehealth services. I don't think they've gone away just because there's no more emergency pandemic situation. Those services still exist to your advantage to access care from anywhere. So it doesn't have to require you to go and see a doctor. You can use your phone, you can use video, you can use chat, whichever option works best for you. All of that is still available for most Medicare coverage programs. Some telehealth services will only be available in rural areas, for example. Mental and behavioral health services can still be accessed from home or no matter where you are. So again, those is, I think, where this mental health issue comes into a lot of play here. If you're having any of that challenge, please take advantage of the telehealth services to use that. And to wrap it up here, as I was promising, I'm going to kind of break it down, the main takeaways that you have to really stick to keep an eye on, just to keep yourself on the good side financially, because this is going to follow you for the rest of your life in Medicare if you don't heed to these warning. So I'm going to start here by saying it's a warning to all those who are new to Medicare, especially just because you have no idea about it. I don't think Medicare really takes that as an excuse. It's your duty of care to know the rules and stick to them. So the late enrollment penalties is what I'm going to be focusing on here, going out of this whole podcast or conversation today. The reason why I've skip it to the very end is because I wanted to stick, right? So remember, late enrollment penalties here says if you don't sign up for Medicare Part B, as in boy, which is the outpatient hospital doctor services, that kind of stuff, you will incur a penalty, as well as the Part D, which is the prescription drug coverage. So when you're first eligible, you will get penalized if you do not sign up for those 2 programs, right? So once you turn 65, please do well to sign up for your Medicare Part B and D as in David. B as in boy, D as in David. These penalties stick with you for the rest of your life. So make sure, you know what I mean? Make sure you do your due diligence to take care of those, to avoid paying penalties for the rest of your lifetime in Medicare. So another thing that I also usually really bring into attention towards is knowing when you're going out of network and staying in network, right? Because a lot of times I use that even in a classic example with my own family. My wife, for example, would have the kids to a special situation would arise. I understand it's an emergency. The first thing she does is she would run to a certain emergency or a certain place or facility without really checking which one would have been our best option in terms of network, right? So there's in-network, out-of-network. In in-network situations, you would pay less than if you were going out-of-network situations. So that's really something I also like to say, because it's going to save you more money. You would incur more costs if you go and see a doctor out of the network than if you were seeing a doctor in-network. So those are really basic things that will save you some money, right? In the Medicare Advantage plans, that's a very classic thing you would come across, because majority of the Medicare Advantage plans work in-network. That's really what the difference is. If you're on the Medicare Advantage plans, be mindful on out-of-network charges. So always ask, right? If you're going for any services to a particular provider, ask them, are you under the network of X, Y, and Z insurance company that you are with? If they say no, I would rather you call that insurance company and find out who is in your network and try to use that network provider first before you say, oh, okay, this might still be something I would prefer and I don't mind paying that extra, right? It's really important. But you will likely pay more, obviously, if you go out of network. It's just the way it's designed. So it's always a good idea to check your network before you sign up for anything. classic example is if you are with a specific doctor that you want to stick with, always make sure they're in the network. If you're with a certain specialist, make sure they're within the network for the plan that you're going to join. All that kind of basic stuff really matters when you're making a decision on who to or what program to join on Medicare. Again, if you're on original Medicare, much of that doesn't seem to matter because you're pretty much having that flexibility. But if on original Medicare or on an Advantage plan, then you want to take into consideration what network you are in or what you're not in. Right, there is also what they call a double coverage pitfall. So if you're already covered through a job or health insurance marketplace, switching to Medicare is essential once you turn 65. So if you keep both types of coverage, you can actually cause issues like higher costs or even penalties, right? So you can't have both. What I was trying to say earlier, like if you really need to still cover some dependents, go ahead and keep that job insurance and just say you're not using your Medicare until you retire or until you decide not to stay with the coverage to the employer. So that's really the last thing that I really want to highlight here. And again, I just want to remind you all, I'm Nkeng Forka. I am actually a licensed health insurance professional, and you would find the details on this comments on the details of this podcast. I will put some links there, and you can actually go in there and ask for help if you need help. I'll be more than happy to help you make that transition to Medicare a breeze. Especially going into 2025. Remember, there are annual enrollment periods which runs from October 15th to December 7th. You must choose your coverage during that time period, within which if you do not, you are actually putting yourself open there for penalties. So please do well to do that if you are new to Medicare. If you're not, that's fine. You just want to make sure your coverage for 2025 is updated, right? What you had for 2024 might not have worked for you, or even if it did, there might have been some changes in the coverage. So always do your due diligence to know what will be working best for you for the new coming year, 2025. So I still recommend you to touch base. If you need help, I will put all the links and all that you would need to get access or to get help from my crew and my team here. We do this as a fiduciary service provider. So your interest comes first before ours. We want to make sure that everything that we're doing works for your family and yourself best before our own interests. So take a look at the description of this video. You would find more. And obviously, if you have any other doubts or questions relating to Medicare, I would always direct you to the official medicare.gov/plan compare website. There you would find all the different Medicare plans compared side by side. That's really where I think you could go ahead and start exploring. But if you're doubting, if you're not sure about what you're doing, please don't hesitate. Reach out. We'll be more than happy to hold your hand and make that leap with you into the Medicare world, especially for the new ones. And if you're already in Medicare and still having some confusion about what would work best for you, I don't mind helping you to review your coverage for 2025. And thanks again for tuning in and to Talking Health Insurance Hacks with Nkeng. I will leave it at that. Thanks so much for your time. Be sure to subscribe, leave a review, and share this episode with anyone that you might find this information helpful to. I think that's the way we can impact more people. By giving them the information that they need to stay smart, make smart decisions, and stay healthy. And I'll see you next time.